wound, infection, anything like that, it's gonna be you guys. If you don't catch it soon enough, they could go into DIC and die right there in front of you.
Why is the routine placenta positive? Because it has a sepsis return process? Like
Either-
how exactly does that?
Either or, right? Because the sepsis, that massive bacterial infection can introduce that damage from the tissue, right?
Oh, okay. Yeah.
And that tissue factor that's trying to clot that up into the bloodstream. Or, it could also just be that, again, the placenta, that's a vascular tissue. And it is tissue, but it's also hooked directly into the bloodstream.
Okay.
So in this case, it could have been both ways, but sepsis can cause that in and of itself. You don't necessarily have to have something like a direct link into the bloodstream from like a placenta.
So as a nurse, when you're like, what would you be really looking for to make sure it didn't have like the pus and stuff, or?
Yeah, pus, red, swelling.
Again, once the patient gets to this point, it's kind of hard to treat.
Yeah, we're talking like high 90% death rate when it's to this point. Okay, some people, they do have something called chronic DIC, which is like very, very tiny, but it's chronic. That's not what we're talking about. That's like a thing in its own. But yeah, I mean, you look for, when you're doing the post-surgical, they'll train you on that kind of stuff, but again, you'll know after a while what typical post-surgical scars are supposed to look like, feel like, how much they're supposed to swell, and if there's anything unusual, you need to get that surgeon back there immediately.
They have a blood panel now, the GCU blood panel, and that test usually kind of helps.
Yeah. Yeah, that's true. You guys got a couple of years before you're gonna be out practicing out. You know, they might have Star Trek things be way over by then. It's ridiculous how fast technology is going. Yeah.
So is the main difference between DIC and hemophilia? Hemophilia is more platelet.
Nope. Von Willebrand's has broken platelets. Hemophilia A and B have clotting factors in that same cascade that are messed up. DIC is, you don't have to have any genetic anything. Anybody in this room could get it under the right circumstances.
This one's acquired, and all those that whole clotting factors are being used up, and that's what's causing that bleed. Yeah, because of something else. So this one is caused by something else. So like we already mentioned, retained placenta or sepsis. All the clotting factors are used up, so you're not clotting anymore, so you have a risk of bleeding out, which is what's been seen here.
Cheesy. Any other questions on that?
Do they die from like a heart attack or from blood loss? So like the clots are going inside their body, do they die from like an embolus, or do they die from like?
That's a good question.
What?
Or is it both?
They die.
Well, technically, everybody dies from a heart attack, right? Otherwise, you're not dead. Your heart's still going, but, yeah.
Do they die from like, do they die from clot?
They can die from any of the above. If you get a big enough embolism in your brain, you're dead. Get a big enough one in your lung, you're dead. Whatever kills you first.
I'm confused with like how, if you're saying that they're clotting, but then all their clot factors are gone.
That's because they use them all up. That's how severe this is. You literally, all of these clotting factors in that cascade, they're all being used. Because again, tissue factor is supposed to be in that extrinsic pathway if you get like nailed in the arm with a really good hit or something, right? That's tissue that's gonna bleed, and that'll clot that up, right? So pretty powerful stuff to clot up the tissue bleeds. Massive crush injuries will lead to this. You know, like if you're literally, like your leg or something run over by a car. Because now there's a ton of tissue factor trying to repair all that tissue, but it can get in your bloodstream, and then it's everywhere, right? And you burn through all your clotting factors pretty fast if it's going through your entire bloodstream instead of just one place. make sense? Yeah, no? Slide.
So you said the intrinsic is related to the vascular system and then the extrinsic is tissues?
Yes. Questions, or are we good? Okay, shall we move on?
Yes.
All right, Ariel, 32-year-old female from Europe, and her husband Eric have been happily married for 10 years. Thanks for the one person that got that. She leads a very busy and high-stress lifestyle, working as a coach / instructor for athletes in the Atlantic Ocean. Having dedicated so many years to her education and job, she has thought of finally settling down. However, Ariel has had a tremendous difficulty conceiving a child for the past 2 years. Lately, she has complained of having lower back pain and constipation, but is unsure whether this is related to her high-stress job. Upon visiting her doctor, she also complained of experiencing sharp pain when engaging in intercourse with her husband. A hormone test was conducted showing her FSH levels were normally high, and an ultrasound scan showed small nodules lining her uterus. Any idea what might happen? Yes, exactly. Okay, what we're looking for in this case is endometriosis, okay? If you, that one part is, that's in, all you really needed was this. Small nodules lining her uterus. By the way, that's pretty typical of case studies, okay? You can get away with almost one line half the time. All right, so what this is endometrial tissue, that's active, right? That's building up, that's shedding off every month, right? Bleeding, building, bleeding, building, right? Normal hyperplasia, okay? Well, if sometimes pieces of that actually get in other places where it does not belong. When that happens, guess what? That endometrial tissue still builds up, sloughs off, builds up, sloughs off. Okay, but now it's in, let's say, inconvenient places. Okay, so someone with endometriosis will fill that cyclically like they would with menstruation. Okay, their menstrual cramps, their bleeding, their pain would be, again, how close can you tell whether it has a uterus or not? You can tell it's increased. Might be, depending on how many pieces of endometrial tissue are where, you might get bleeding in the abdominal cavity, which cause, a lot more issues and pain and that sort of thing, and pressure. But the key to that case study was multiple small nodules. You can see where that looks like a nodule, right? That's not, you wouldn't describe that as a mass or anything, it's just a little nodule, okay? But you get them typically multiple places. You can see where this one right here, sitting inside of that ovarian tube, would possibly cause infertility, right? Because that egg might not be able to get past there, okay? What else do I want to say about that? Obviously, it causes bleeding. If it can get out, depending again where it is. Okay, if there's endometrial tissue, again in those ovarian tubes or fallopian tubes, that is probably going to hurt the most. There's not a lot of room in there. Yeah.
This might be a stupid question, but I'm still gonna ask. Isn't there something called like something with uterus polycystic? How do you know it's not that?
Polycystic ovarian syndrome is a bunch of cysts on your ovaries. And that is also, typically, it hurts more during menstrual cycle kind of things. Not that you have many menstrual cycles with PCOS, but that was the whole point of the ultrasound, right? Those ultrasounds don't even see cysts. They can't even see these little endometrial pieces. They can see polycysts on your ovaries. But nothing just occurred to me that this case study, yet you couldn't even see that with an ultrasound. Endoscopy? No, that's the thing. You can see it. I mean, obviously laparoscopically you can see it, and that's what they're doing here. But again, now you're poking home with somebody to look for it.
There's one that they go in through, it's like an endoscopy, but through.
Transvaginal ultrasound. That-
Yeah, but they can't do, that's the only way to diagnose it.
Endometriosis?
Yeah.
Yeah. I don't know. MRIs and CTs are getting better every day. I wouldn't be surprised if they were good enough. But again, this is soft tissue, on soft tissue. So even that would probably be extremely difficult. Yeah.
How do you know this wouldn't be, leiomyoma?
Because leiomyoma is another word for a fibroid. A fibroid is typically a single, it's a smooth muscle tumor. Don't get confused by this drawing where it shows them all over the place. These are just drawing where they could be, okay? Typically, we're talking like one, right? Might be, I don't know if you could call this two or not, but typically, maybe two, but these are, leiomyomas are fibroids. You guys, some of you probably heard of fibroids because your mother, aunt, or somebody might have gotten fibroids, okay? That's a smooth muscle, benign, not cancerous tumor, and it just gets big, okay? Now that you can clearly see with an ultrasound, with a CT, with, geez, almost an iPhone. I mean,
Oh
they're
my God.
tumors, right? I mean, they're actually growths, they're masses. Yeah.
So would these only be in the uterus, not in like the fallopian tubes or the ovary?
Well, technically, little myoma means a smooth muscle tumor, benign smooth muscle tumor, and the ovaries, I don't think are muscles, they're an organ, I guess. I guess the uterus is an organ too, but I think you have to have smooth muscle to actually call it that. I don't think ovaries have smooth muscle. They're just an egg.
No, the uterus does.
What?
Mhm.
Has to be an old person?
Hip replacement?
Oh, just because they have a hip replacement, they're old?
On average.
Okay, fine, if you're playing yacht. Questions? Again, these signs and symptoms on leiomyoma, I don't know how to try to memorize them, but if you think about it, you have a mass, a growth, a tumor. Is that going to cause abdominal discomfort? Yeah. I mean, is that gonna press on things? It's gonna, it's pressing on things, it's hurting things, it's causing you to have to go to the bathroom faster because it's pressing on the bladder, just like a baby would. I mean, if you got a growth, in or around your uterus, it's going to press on things, and that's going to cause the same kind of symptom, really. Okay? Questions? Okay, don't be this lady.
Oh, man.
She has one fibroid or leiomyoma. She has another little fibroid. She has a big old cyst. She has little endometrial pieces, so endometriosis. And she's got some fascia being kind of ripped and torn while they're at it, adhesions.
Wow.
So she's got some issues. Yes?
With something like this woman, poor woman, would this be more like genetic influence or just like how would you get this bad?
You know,
We have so many things pop up.
I don't know. One, there's a whole bunch of stuff in here.
Yeah.
So I mean, endometriosis, unknown, hormonal, maybe family history. They see it more in Caucasians, right? If you go back to the leiomyomas, genetic, hormonal, we don't know. I mean, there seems to be some relationships that